Hey, this is Kaylee from Madison Memorial, and I'm here with Dr. Wells. We're practicing social distancing, and we're also, Dr. Wells is going to answer a few of the questions that you as the community have asked over the past couple weeks. So without further ado, I'm going to go on the other side of the camera and ask the questions. So, Dr. Wells, what do we know about the coronavirus?
Well, first of all, I just want to thank all of you for the efforts you're putting into social distancing. It's really making a difference. Even in our small community, it could be the difference of dozens versus hundreds of cases and deaths. What we know about coronavirus is that it is a virus similar to influenza, but it tends to affect certain groups in a much more severe way, so that the numbers of deaths are a lot more pronounced. It is transmitted in a similar fashion, though. It's transmitted by close personal contact. So someone who has the virus has a cough, sneeze, or they touch their face, they touch an object or another person and transmit the virus.
How long do you think we should practice the social distancing?
We have not had our surge in eastern Idaho. It is coming, and so I think we will need to continue social distancing for the next at least 2 to 3 months. I anticipate our surge of patients to come within the next probably 2 to 4 weeks. So we have to be patient and continue to social distance and quarantine probably through July and August to be effective.
What are the symptoms?
So the virus is fairly predictable. You have a point of contact, and then for a couple of days you may not even notice you have the virus infection. You may have no symptoms or minimal symptoms. Then by days 3 to 5, you start to manifest symptoms which include nasal congestion, runny nose, sore throat, fever, cough, headache. There is a characteristic lack of taste and smell that we're seeing, body aches, and then even nausea and diarrhea.
When are you safe? When is someone safe to go back to work or out in public after they've had the infection?
Typically, once that you've had your infection symptoms, which usually last for a week, you are safe to go back to work at about 3 days after fever and your symptoms have receded. So no cough, no fever, 3 days, and then you should be safe to go back to work.
When do you recommend people go to the hospital?
You should come to the hospital anytime you feel shortness of breath. Even if you have symptoms of body aches and you're miserable with high fevers, nasal congestion, pain, you don't need to come to the hospital unless you have shortness of breath or difficulty breathing.
What should I do if I get sick and have a high-risk person in my home?
So a very important question. First thing is, if you have these symptoms and you live with someone who's high risk, and I should define high risk, that's someone over the age of 65 or with history of disease in the lungs, heart, liver, kidney, or diabetes, or a weakened immune system. If you live with a person like that and you can move your residence for the time you're sick, that's best. If you can't, you have to practice very safe self-quarantine, where you cover your mouth, you cover coughs and sneezes, you, besides isolation, you clean all surfaces that you're touching, all objects you're touching, so to limit any exposure to that high-risk person.
What about treatments?
So treatments are essentially ongoing, or at least our understanding of them is growing. This is a virus we've never seen before. So we take information from previous viruses that are similar, and now there are at least 130 studies, of which I'm aware, ongoing to figure out what works and what doesn't. Some of the treatments that we have seen that have been recommended haven't been proven and have risk, so you want to watch and ask trusted sources for information. So low-risk things that we know seem to help include good nutrition, good sleep, and hydration. Vitamins like vitamin C and zinc, also low risk. The other medications that you'll see on websites include azithromycin, hydroxychloroquine, and there's a whole host of antivirals and anti-inflammatories that we could use, but we want to make sure that they're safe and effective. We are using them, we meaning emergency departments in the country are using different regimens and medications, and they're being studied as we go. So you'll read lots of things online, but I could summarize it, I guess, by saying we don't know yet what helps well, and we don't want to give you something that might hurt you. So each day I'm reading and studying what's being tried and studied in emergency departments all over the world.
What about a vaccine?
So the vaccine is being developed, and in about 9 months we will have a vaccine that we can use. But it takes a lot of time to develop a vaccine safely. So we don't have it for the next few months of this pandemic.
What about anti-inflammatories? Are those dangerous?
So much has been written about the typical anti-inflammatories you might use for cough, for fever, for body aches, like ibuprofen or Aleve. Those were associated with increased or more severe disease in China, and so for the time being we're recommending not to use ibuprofen, Aleve, or what's called the non-steroidal anti-inflammatories until we get more information. Tylenol, however, seems to be safe, and you can use that.
What about blood pressure medications? Are they okay to take those?
It is good to continue your blood pressure medications. We don't have any reason to say stop those at this point.
Are small children and infants at higher risk to die from this infection?
All of the information that we have from around the world suggests that even infants, but especially all children, get a milder form of this disease than folks over 65, the high-risk folks. So yes, the kids are getting it, but they're getting much more mild symptoms. And to date, the percent of kids that are getting severe symptoms or dying is so much smaller than any other group, as to say it's a very mild form of the disease.
If someone is sick with a high fever, should they go to the doctor?
The fever doesn't increase your risk for severe disease. So because you have a high fever or body aches or other symptoms, you don't have to come to the doctor for that. I would say watch your breathing. If your breathing becomes labored, or you're having difficulty catching your breath, or you feel short of breath, that's a reason to go to the doctor.
What do you have to say about testing?
Testing is still in East Idaho a bit frustrating because it's taking a long time to get results. We will be getting the short turnaround test, the one that comes back in an hour, and we hope to have that within the next few weeks, but at this point it takes several days to get your results back.
What do you suggest on preventing social distancing fatigue?
It's going to be a little tough. I think all of us are going to be tired of COVID and all of these precautions we're taking within the next few weeks. Many of us are already tired of it. But this pandemic will not run its course at least through August. So we've got to hang in there. What you're doing really matters. It's really helping. So far in East Idaho, at least in Madison County, we've had no severe cases. And I attribute part of that to your efforts to social distance, quarantine appropriately. So you've got to keep at it. Don't get tired and stop. I anticipate that by late August, September, we might see that this has run through its initial course, and we can stop with the social distancing. But until then, until we've seen our surge and then the surge is completed, we should not stop these measures because they're really helping.
Thank you. Do you have anything else to say?
No, thanks for your great efforts. We're all in this together. Keep it up.